Good morning, and thank you for joining us today to talk about the power of integrated care advocacy. My name is Josh Schreiner, and I'm the Chief Product Officer at HealthEZ. Joining me today will be Tammy Bergwald, our Clinical Director for Medical Management, and we're very excited to talk to you about some of the different components of our program. So in today's webinar, we are going to hit on four main topics. Number one, what does advocacy mean at HealthEZ? Why it's important and why it matters for you and your customers. Arguably, most importantly, how it's integrated into our entire ecosystem. And then last, but certainly not least, some real-world outcomes and reporting insights from leveraging our solution. If you have questions during this webinar, there is a chat. Please feel free to put those questions into the chat, and when we get through the end of the presentation, we'll be happy to answer those with whatever time remains. And with that, I'm going to turn it over to Tammy Bergwald.
Yeah, thank you, Josh. I'm excited to be here today and get to share with all of you what our advocacy program really looks like here at HealthEZ. I think if I've had an opportunity to meet you, there's a super good chance that you know already how passionate I am about care advocacy. And for those who I have not met, my hope is that you can get a good feel for how our program is really different from what you're used to seeing in the market today. So what is care advocacy? Care advocacy at HealthEZ is all about human touch. It's a high-touch support system that helps our members navigate the complexities of healthcare. Our advocates are fully embedded within HealthEZ, and they're here to really bridge that gap between our members, their providers, and overall care teams, with an end goal of steering folks in the right direction to get the care that they need and deserve. Our advocates offer support, guidance, resources for all of our members to make better healthcare decisions that ultimately lead to not only healthier but happier lives as well. So the key with HealthEZ is that our advocacy isn't a department or a call center. It's really a mindset, and that mindset shapes who we support every single member. And you often probably have heard me say at the heart of it is people helping people, and that's truly what makes it powerful. Which naturally leads into the question of why does it matter? Well, it matters in today's world. As we all know, healthcare can be extremely confusing and overwhelming. Actually, let me rephrase it, not can be, but it is confusing and extremely difficult to navigate. So that's where our approach makes it personal. Our team builds relationships with members, making sure that they feel seen, heard, and guided. Because when people feel supported, it leads to better health outcomes, higher satisfaction, smarter use of benefits, and ultimately drives the cost savings for the plan overall. I'm sure we can all relate to that feeling of feeling overwhelmed when you leave a provider's office. So whether that's needing to start a new medication, or you have to find a specialist or make a follow-up appointment for your kiddo. Honestly, even if your job is in healthcare, trust me, you still have those feelings. So having that extra layer of support that you can refer and count on makes a huge difference. And as you can see with our NPS score of 84 and our engagement rate of 71%, our members would agree that this type of support really does help. And with that, the way that we really make an impact is through engagement. So Josh, you can switch it to the next, there we go. And we start by proactive and outreach early. We don't want to wait until a member actually needs care or a problem shows up. Our advocates are here to support and onboard members, before even the plan goes live, which sometimes is up to 90 days in advance. Honestly, we've all had that feeling of pressure of, oh my gosh, my benefits are changing. How is this going to affect, me or my family? Are my providers going to still be in network? Will my chemotherapy be covered the same? Or can I, fill my same insulin at the same pharmacy? All of these scenarios can really put unnecessary stress and pressure on all of our members. So what we find is that opening up our advocacy services, even before a member has their ID card in hand, makes a world of difference in not only the continuity of care, but limits the noise come plan day one. And this really sets a tone for a strong and trusting relationship. It also takes the pressure off the HR and the brokers because members then know exactly where to turn to for all of their questions. They will also have a one point of contact, someone who knows their story and can guide them through their healthcare journey, regardless of how complex the situation is. What does a one point of contact actually mean? On the next slide, Josh, there we go. Every member enrolled in advocacy is assigned to a dedicated advocate. That means no 800 number roulette. Instead, members will have one person that they can call for anything. So whether that's making appointments, checking on a pre-authorization, finding those providers, or even just the emotional support that can be so changing for a member. That continuity really makes a big difference. It leaves members less stressed, more informed, and more likely to use their benefits in the right way. So to give you a little picture, I thought I would just share a recent message I received from a member of how grateful she was for having an advocate to consistently look out for her, actually from day one of getting diagnosed to starting a really high dollar medication. Her advocate was able to help navigate the process of switching to a biosimilar drug recently when it came available to the market. Not only did that save the plan over $200,000 per year, but it also helped take the burden of the cost off the member as well. So the consistent monitoring and outreach really built that connection, which is so incredibly important. So without that trust, this member, in all honesty, most likely would not even be open to exploring other options to changing medication. And then what does tying our other programs look like for advocacy? On the next slide. Advocacy obviously is just not a standalone program, is deeply integrated with everything we do here. So think of, that large case management monitoring, the utilization management, the disease management, pharmacy, and any other carve-out programs our clients may put in, such as our MECO, our EasyRx program, which later, Josh, I know you'll speak on many of these cost saving levers. However, we always want to refer back to our philosophy, which is to always keep our members at the core center of everything we do with that dedicated advocate wrapped around them always. So this integration also, gives us the complete picture of the member's journey and then allows us to align every touch point to their unique needs as well. And because we're so integrated, we're also able to measure the real impact of advocacy in a way that's so meaningful to our brokers and clients. So our reporting capabilities. Although hearing, the navigation and success stories are extremely touching and impactful, we just don't want to talk about the results. We want to measure them. And we do just that. So we're going to track the engagement, the satisfaction, the resolution times, cost avoidance, program utilization, and all of this reporting is available to all of our clients, regardless on size, at any time, and also in real time. And honestly, to add to this, if it's noted, that engagement is coming in a little on the lower side, we're just not going to accept that. We're going to reach out and make some action plans. We're here to offer lunch and learns, webinars, on-site visits, and other outreach connections just to make sure that the members stay connected at all time. And that kind of measurable impact is exactly what makes advocacy such a powerful tool for you, brokers, and clients. And then lastly, before handing it off to Josh, let's look at the value that advocacy really brings. For our brokers and clients, we can promise that this is more than a support tool. It's a strategic advantage. Advocacy reduces high-cost claims, improves employer satisfaction and retention, and then gives brokers tangible reporting that they can bring up to renewals. At the end of the day, we truly are confident and can say that our care advocacy delivers a better experience for everyone involved. We like to think of advocacy as a thread that ties everything together in cost containment. And with that, I will hand it over to you, Josh, to speak on the specific levers.
Thanks, Tammy. That was a great overview of our care advocacy. As Tammy mentioned, what we're showing you on the screen is our cost containment philosophy, our wheel. We have 7 different categories that we feel and offer to our customers as levers that they can choose to pull in order to lower their medical or pharmacy spend. And just to reiterate, care advocacy sits at the middle. We don't believe that we are able to do our job in helping to control costs if we don't have this level of member engagement to help navigate because of the complexities and all of the different touch points that a member can experience when trying to seek care. And we know that it works. We have done a number of data studies to better understand where are we most effective at lowering spend for our customers. And if you take a look at the screen, there's the 7 categories that I mentioned on the previous slide. We've identified where and what impact each of those potential solutions that an employer can choose can have on their actual spend. And for each of these levers, the care advocacy and navigation plays a critical role. So if we take a look at the largest area of cost reduction, which is through smart coverage design, Tammy mentioned a couple specific products, and I'll go into a little bit more detail on the next slide. But the one that stands out and seems to be most top of mind, given the rising cost of medical infusions, is our medical infusion carve-out product. So that is a service that we carve out 275 infusions from the PPO network. So these are infusions that a member would need to either go to the hospital, go to an office visit, or have somebody come to the home. Things like that really design how we are going to cover the benefits is what goes into the smart coverage design. We have things like dialysis carve-out and other products that go into that category that help to reduce spend. All in all, when you take our 7 categories of cost containment and the various levers, our employers will on average save 23% over industry benchmarks by leveraging HealthEZ's advocacy and cost containment services. So some of the solutions that we offer that are meant to reduce costs, but that our care advocacy plays a critical role in. Number one is our precision pricing product. This is a product that targets the top 10% of claims and carves them out from a network repricing methodology and instead uses a median in-network commercial rate of reimbursement to lower spend. We have a new pharmacy solution that we launched at the beginning of this year called EasyRx, which really the critical component of that product is that we carve out the clinical review of all medications over $1,000 and leverage that process to determine which of 6 cost containment channels can provide the lowest net cost. Our goal isn't to stop people from getting their medications. It's really to identify what is the lowest sourcing option for that medication. So we have things like patient assistance, copay maximization, biosimilar conversion, brand to generic conversion. And when you bundle all of those things together, EasyRx can save on your pharmacy plan up to 50% over a traditional PBM solution. We have a low to no cost surgery and imaging bundle. So this is a set of over 400 different procedures. It is a nationwide network of providers that can be tacked on to a health plan. And then our care advocacy and navigation sits embedded in all of these solutions to help let a member know when they are eligible for that. And when a member uses that low to no cost surgery and imaging bundle, it saves on average about 50% over a standard PPO network. And last but certainly not least is MECO, our medical infusion carve-out program. We carve out 275 J codes. Our care advocacy is embedded in that like it is the other solutions and works with the member to make sure that they get their infusion set up while saving the plan significantly over traditional PPO rates of reimbursement. That MECO product was really created to target oncology spend. It is the #1 growing area of spend in the self-funded market. We see it on our book of business, and it seems to be the number one area that employers are clamoring for solutions to reduce those costs. Some of the digital tools that we offer, we do have a fully integrated medical app where you can actually reach out directly to your care advocate through that member app. You can get access to your digital ID card, check real-time status of your deductible and claims. We also offer a fantastic consumer payment service called Easy Pay. This allows a member to use any form of a credit card, debit card, HSA, FSA, HRA in order to pay their patient responsibility at the same time that we are processing the claim. As a father of 3 children who are now VIPs at the urgent care where we live, this is a fantastic, convenient solution to not have to worry about medical bills and cross-checking to see, did my provider bill me the right amount? At the time that you make a payment with Easy Pay, you also get a copy of your EOB so that you can see that the amount we're telling you you owe is exactly the amount that you owe. We also offer a cost comparison tool called Easy Choice, and that allows members to shop any medical procedure and get a cost comparison based on their benefit information, as well as the PPO network that they access. And then lastly, our mobile app website is multilingual. You can actually translate the app through an accessibility widget into 50 different languages, and it's also ADA compliant. So lots of member-friendly features to make leveraging your benefits with HealthEZ as easy as possible. So why is HealthEZ different? This comes back to one of the first points that Tammy made, which is that our advocacy is embedded here at HealthEZ. The team is on-site. HealthEZ employees have full access to all systems, and they are able to leverage all of that data and information to understand when is the right time and who do we need to make outreach to, so that we can not only provide help and white glove service to the member, but also leverage that relationship to drive cost savings for the employer. We've embedded this. Our customers all have this product. It is very personal. To Tammy's point, a member is given a dedicated advocate. They're not going to talk to a different advocate every single time that they call in. They're going to get assigned a particular person. They'll get their direct phone number and they can call them for any of the questions and needs that they may have as they're navigating their healthcare journey. And then last, but certainly not least, is that our care advocates solve problems and they build trust. So when members can't get an appointment, or a member doesn't understand why they're getting a bill, or a member doesn't understand why their provider is saying that something isn't covered. And oftentimes it's the provider not fully understanding the benefits. Our team is here to help answer those questions and solve them so that you, as the consultant and employer partners, don't have to be in the middle of these challenges. And as we solve those problems, we build trust and we make the member feel like we're here to help. And that's the only motive, that we're here to be a point of help for them on their healthcare journey. This has been a core offering for HealthEZ for a number of years. It is a huge differentiator in our product offering. And we feel that we can't do our job to lower costs without having this service. So we really appreciate you joining this webinar, and we will take any questions.
So Josh, there's one question already, and it is international sourcing included in EasyRx?
Yes, it is.
Are you all seeing stop-loss carriers give decrements knowing how many services you have and how integrated your services are?
Absolutely. So our we shop to a global panel of carriers. We do have, call it 4 to 6 carrier relationships where they have seen the results of our cost containment programs, and they are giving rating decrements. depending on which set of services or cost containment solutions that you buy. So when you buy EasyRx, Miko, Precision Pricing, those have been vetted with our primary carrier partners to give you additional rating credit. Yes.
Tammy, what this isn't a question that came in, but I just thought of this that maybe you could talk a little bit about who is on your team, like nurses, you've got dietitian, that kind of thing. That would be great.
Mhm. Yeah, absolutely. So we do have registered dietitians, nurses. We have clinical staff such as certified nursing assistants. Truly, when we're looking to hire, it's somebody who is going to be extremely passionate about helping members navigate, across the healthcare system. Obviously, our advocates are not working alongside of members, in the setting of clinical settings. So we're not there to hold their hand. So most importantly, you have to be able to do that across a phone or through a text message. And that type of communication has to be really again, personable, but we have to sit back and listen to the member because at the end of the day, the member knows their journey. They know what they need and want as far as healthcare. So that's what we're there, to do. We do have all of our, board certified physicians that are reviewing for medical necessity in the certain specialty. So that's extremely important too. And then, of course, our case managers are registered nurses who are overseeing case management alongside of advocacy.
Great, thank you. I think that was important. And hey, Josh, would you like to mention the recent savings that our new client that has EasyRx has been seeing?
Yeah, so we have a number of clients that have purchased EasyRx already this year. We just did a deep dive on data for one of those customers. They moved to HealthEZ newly this year, so they were brand new to HealthEZ as their third-party administrator, and they moved from a carrier product. In that carrier product, they were spending about $87 per member per month on their pharmacy spend, which from an industry benchmark standpoint actually is not too bad. In their first month of EasyRx, their PMPM was $29.30. Part of the reason for that is because we carve out that clinical review, we take it away from the PBM. We're much more effective at obtaining patient assistance. Second, because of that clinical review, we're also able to identify quickly and route the specific medications that are eligible for cost containment into the right channel. And so just in the first month alone, we saw almost 11% of their spend from last year was approved for patient assistance in the first couple of weeks of their plan year. So we're getting very good positive customer feedback. And it is making a big difference on employers' pharmacy spend.
We have another question. Are you seeing your carrier network partners allow for the plan document to incentivize members into the surgery centers, imaging centers via deductible and copay waivers, and assuming they have been okay with the infusions being carved out and redirected via Miko?
Yeah, so I think it's really important to distinguish between network access and benefit design. At HealthEZ, because we're a third-party administrator focused on cost reduction, we've been very clear with our network partners that they don't dictate benefit design. So in short, to answer your question, all of these product solutions that we're bringing, whether it's Miko or the surgery and imaging, we are able to offer those with our national network partners because of how we've negotiated those relationships and contracts. So Miko has been up and running now for almost 2 years. Almost half of our customers have bought it. It is having a dramatic impact on oncology spend. We had a case for an oncology patient that the network allowable on a Buka network was almost $700,000 for 9 cycles of Keytruda. we were able to actually get that reduced to zero. So not only did that employer save, but that carrier saved significantly on the cost of that medication, all while using a national carrier network.
Not seeing any other questions, so maybe we could just give it about 30 seconds, see if anybody has any. Well, if no one has any other questions, Josh, I think we can wrap it up.
Great. All righty. Well, we appreciate everybody taking the time. If you have any questions that you think of after this webinar, please feel free to reach out to your sales or account management contact, and they'd be happy to get your information, and then we can respond to any questions that come up after this meeting.
Thank you, everyone.
Thanks.
Thank you.